Hey guys, welcome back to Healing Unfiltered. This week, I'm going to kind of talk off the cuff. I usually try to have like notes to follow along, and today I just don't feel like having notes. And to be fair, when I have notes, I like have them up as a guide so that I like touch on certain points that I want to touch on. So I'm very rarely like following them anyway. And so today I just was kind of like, you know what, screw it. I have a topic that I really want to talk about that I think is one that I think a lot of people will be interested to hear about. We're going to talk a little bit about ADHD, but more specifically, ADHD within the realm of therapy. And the more and more that I am exposed to concepts related to ADHD, more so in relation to like quality of life. I'm not talking like typical symptoms, like do you check this box, or this box for ADHD, but like how it impacts your life. The more and more I'm finding that this is something that, for as much as ADHD is talked about, this specific area of it is not. And so we're going to talk about it today. We're going to dive in and we're going to see where my brain takes us on this journey of talking about ADHD. Now, the part of this that, like I said, is not talked about very often is I think more so maybe the like domino effect of mental health that comes from having ADHD or being neurodivergent. We talk a lot about like, oh yeah, I have ADHD. And so as a result, I have things in piles in my home, or I forget appointments, or I start something and then don't finish it, or I have a fixation and then it's gone the next month. Like we talk about like those qualities of ADHD in particular, but we don't really talk about the domino effect. Like I said, the things that come as a result of ADHD. And I was having a conversation with one of my clients this week who has ADHD, who is trying to figure out what medication is appropriate for her and just kind of like, I guess, trying to figure out how do I figure out a way to live my life in a way that feels happy, to where my ADHD is regulated, but I'm not minimizing the struggles that come along with it. And she had said to me, she was like, I gotta say, of the therapists that I've had in the past, you're the first that has talked about my other mental health issues, so like depression, anxiety, trauma, in relation to ADHD. And it got me thinking about conversations that I've had with fellow therapists, and even like when I was a newbie therapist, things that I was thinking about on my own. When I was younger in the field, my first years as a therapist, if someone came in and said, "Oh yeah, I have ADHD," I'd be like, "Ah, fuck. I don't know how to fix that." Because as young therapists, we're trying to figure out, not necessarily that we think we need to fix people, but people come to us wanting to be fixed. And so, as a young therapist, people would come in and be like, "I have ADHD, I have this diagnosis." And you'd be like, "Okay, what coping skills?" Like we go to the basics. And that's so annoying to me as a therapist now and just as a human being now, because when people come into therapy for ADHD, sure, sometimes it is for purely executive functioning, purely like I am not functioning in my life. I am not doing the things I need to do. But honestly, I'd venture to say that majority of the problem that's there is, yes, I'm not functioning in my life. But the reason I'm coming to therapy about it is because I feel like shit about it. I feel like I'm lazy. I feel like I'm not doing enough. I feel like there's something wrong with me. And in that case, we're not talking about coping skills or tools for your executive functioning. You could go on to Google and figure out all of the same things that I would instruct you to do for tools for executive functioning. We need to work on your identity in relation to your ADHD. And I think one of the things that happens in therapy is we get caught up in the details of what is being said, of like what's going on in life. And then we might get caught up in the depression, the anxiety, the trauma. And when I say caught up in it, I'm not saying like, I'm not implying that we're spending too much time talking about those things at all. I'm just saying that then we get so focused on those areas of mental health that we then neglect the ADHD. And what happens then is we're not connecting the dots between someone's depression and someone's ADHD. We're saying, okay, you have this issue of depression. You're struggling with feeling motivated because you're feeling sad, hopeless, you can't get out of bed. And you have this issue of ADHD and executive functioning, overly compartmentalizing the two. And I think we need to start looking at how they go hand in hand. So my goal for today's episode is to open the conversation of that and I guess kind of explore the damage that can be done if we're over compartmentalizing and we're not looking at how ADHD can impact quality of life. So with that being said, let's talk about how ADHD can impact quality of life. So first and foremost, like I just said, if you're somebody who struggles with executive functioning, or you're somebody who struggles with following through with things. I've seen so many people, myself included, who go down this rabbit hole of like, why can't I get my shit together? Like, why can't I do the things that I know I need to do? And we might know, like, yeah, my brain's not wired or working the way that it's quote unquote supposed to or in a neurotypical way. And so we might be able to validate that in one moment, but then because we over compartmentalize, we kind of say, okay, whatever, you still should be able to get your shit together. It's not that simple. It's not as simple as saying, like, okay, you're unmotivated, too bad, push through. And so the result of that, the damage that can come in like a quality of life perspective when it comes to that is low self esteem, issues with identity. So you don't know who you are outside of your ADHD. And so then that plays a role in like, well, I'm just a lazy person. We over identify with the executive dysfunction. This disconnect here plays a huge role when it comes to our confidence and our self esteem. And if we have low self esteem, how can we expect ourselves to go through life? Life is hard enough as it is, like we talked about in, I think, my last episode, especially when life is heavy. If we're struggling with executive functioning and we're feeling like shit about ourselves, how are we expected to then enjoy the other aspects of life? So, number one, I think we really need to start looking at how does your ADHD impact your view of yourself? What are the beliefs you have about yourself because you are not neurotypical, because you are neurodivergent, because you do have a brain that's a little spicier than what someone might consider typical? And so I think when we look at it from through that lens, we can start to maybe appreciate the nuances of it. We can appreciate the differences, but what we have to get to first is whatever story you've been telling about yourself as a result of your ADHD. I am lazy. I'm not good enough. I need to do more. Those things are all bullshit. And we can figure out a way. That's where the tools, the executive functioning, potentially the medication come in to maybe make those things better. But even if you make those things better, they're not going to be perfect because neurotypical or not, nobody is perfect when it comes to that. Everybody has days where they're lazy. Everybody has days where they're not following through with what they need to. So you could get your brain functioning as close to higher executive functioning as you want and still have days where that narrative pokes back into your mind saying, you are a piece of shit, you're lazy, you're not doing enough. And so, with that being said, if we don't clear that out of the way, you could be functioning so well and you have one day and you're right back to that square one of low self esteem. So, low self esteem is one of the first things that if you're coming into therapy and you say, I have a diagnosis of ADHD, or if that's something that we're exploring, we're going to look at that first. Like, we're going to look at how do you view yourself in relation to your ADHD? And therapists out there who are listening, I really, really, really encourage you to look at it through this lens because, like I said before, especially early on in my career, I know young therapists or even experienced therapists who have seen a lot of ADHD, a lot of different presenting issues. Our goal might be, okay, executive functioning. How do we improve their executive functioning? Sure, yes, we have to do that. But we also want to understand how is this person viewing themselves in relation to their symptoms, especially because ADHD, I think, is one of the highest correlated diagnoses with self-esteem when it comes to productivity, worth, what can I offer the world? Okay, so other things that it can impact in life, relationships. This actually is one of the biggest things that of my caseload clients who come in with symptoms of ADHD, they come in because their partners are frustrated with them not doing enough. Their partners are saying, I need you to help more. I need you to pull your weight more. I need you to follow through. I need you to just do the shit that we need to do. And then as a result, not only do we have that first layer of, well, now I feel like a piece of shit because I'm not doing enough, but we have the added tension of, well, now my relationship has tension within it, or there's problems within my relationship because I'm not pulling my weight in the relationship. I have a few clients that fall into this category, and not only clients, but in my personal life, people that I know that I see this play out all the time. And again, especially if we have somebody who is neurodivergent and we have somebody who is neurotypical in a relationship, which is often the case, we do see that a lot, there's going to be discord there if the executive functioning isn't being addressed or is in that dysfunctioning category at the time. And so what we want to look at here is, okay, step one, how are you viewing yourself in relation to your ADHD symptoms? How do you think your partner views you in relation to your ADHD symptoms? Because here's the thing, your partner might be frustrated with you, but just because your partner is frustrated with you does not mean that they think you're a lazy piece of shit. And if we have that narrative in our heads of, I'm a lazy piece of shit if I can't clean the house, do the laundry, go grocery shopping, whatever it is you need to do, and then our partner gets frustrated with us for not pulling our weight, well, then we're going to project that narrative we have of ourselves onto what they think of us. They might just be frustrated. They might just be like, yeah, I need a little help. I'm exhausted right now. And I really could use your help. And it could just be that. It could just be matter of fact, I need more help. But you're telling yourself then as a result, my partner thinks I'm a lazy piece of shit. And then we have this kind of like downward spiral of, things that come from relationship issues, which is a whole nother topic, even separate from ADHD that I can talk about another time. But we can have resentment, we can have fear, we can have a lot of times, especially with ADHD, is we think, oh, my partner's a lazy piece of shit. And a lot of times, what we see with ADHD in relationships in this kind of scenario that I'm describing is we have like, okay, my partner thinks I'm a lazy piece of shit, and we go down that self sabotage. It's kind of like, well, I'm a lazy piece of shit. So what do you expect from me? And not that we don't want to get better, not that like the executive dysfunctioning just takes over. But if we have that narrative in our brain of this is what I am, it kind of goes into that learned helplessness that like, this is what I am. So this is what I'm going to be. And I just have to accept that my partner hates me. Like, see how quickly we get to the worst case scenario. And if you have that view of your relationship and we're not seeking connection in those moments because maybe we're ashamed or we're fearful or we think whatever our partner thinks about us, well, then it's just going to kind of be this ping pong back and forth of disconnection. Issues within relationships are a huge thing that we see as a result of either untreated or unmanaged ADHD, or even just the presence of ADHD in general, especially if that first pillar of self esteem is not addressed. Okay, so other things that I want to look at when it comes to this is consistency. So, one of the most frequently experienced things is fixation on something. We get super excited, we get that dopamine hit, and then it lays unfinished and we move on to something else. And so, one of the things that comes with that when we think of damage or impacts of ADHD is if we can't follow through with ourselves, we don't trust ourselves to follow through. So, this I think is a branch off of the self esteem piece, but I want to talk about this more in relation to trust in ourselves. There's some cliche sayings and quotes. There's some awesome quotes from Atomic Habits. If you have not read that, I definitely suggest checking it out, especially when it comes to executive functioning and just kind of routine, which we know is really great for ADHD, routine and structure. Anyway, I digress. There's some cliche quotes of basically like, if you don't follow through with if you don't keep the word that you make to yourself, how can you build trust in yourself? Right. So if I say, I am going to do XYZ thing, and then I go, and then I stop, and then I don't follow through, that is me reinforcing to my brain, you can't trust yourself. You're not going to follow through with that. So then what happens when you have this really great idea or this thing that you really want to do that is going to be challenging? You kind of, again, self-fulfilling prophecy of, well, I've never followed through before, so why am I going to do that now? So, full circle here, what that brings us to one of the impacts of ADHD on quality of life is not trusting ourselves to be able to follow through, and then holding ourselves back from accomplishing things that we might really want to accomplish, things that if we maybe put our dedication to it or we built that trust in ourselves, we'd be able to do. Just because you might be neurodivergent does not mean you are any less capable than someone who is neurotypical. It just means we might need a few different workarounds. And those workarounds, yes, are the tools that we can figure out how to implement. But I firmly believe that we can identify all of the tools, but if we don't deal with the layers of self esteem, consistency, trust in self, how can we implement the tools consistently and expect them to stick for us forever when the tools are not going to work 100% of the time, just like they don't for every single human being? So, the one time that it doesn't work for us, we're going to go back to that self esteem, or we're going to refer to what we view ourselves as. And if how we view ourselves is as a lazy piece of shit, then we're going to confirm, see, the tools didn't work because I'm broken. I just can't function right. Versus if the tool doesn't work and we go back to that foundation of self-esteem, and our self-esteem is founded in, okay, yeah, maybe I need a different workaround. Maybe I just needed a reset. Maybe I needed a moment to be lazy and to not follow through and let my brain kind of come down a little bit so that I can re-experience that spike in dopamine and then I can pick back up. That is going to lead to the consistency. The tools don't create the consistency. Your view of yourself does. The tools are what help you function better when you have a view of yourself that allows you to thrive. So, again, I think that when we look at ADHD, especially in the realm of mental health, therapy, counseling, we're over, this is not a word, symptomizing it. I think, and maybe the better word is we're oversimplifying it. We are taking it and we are saying it is a neurological based, biologically based diagnosis, and therefore we have to treat it as such. And I have seen a number of clinicians that are phenomenal clinicians, great with identity, PTSD, depression, anxiety, everything under the sun. And then ADHD comes in and all of a sudden they're shifted back into this medical model. Why the fuck are we treating ADHD through medical model? Yes. Do we need medication to treat a lot of cases of ADHD? Is that a great tool to use? 100%. Does that fall into the category of medical model? 100%. Same with depression, anxiety, PTSD, all of these different things have components that fit into the medical model. But in the therapy room, why are we talking about ADHD through such a medical model and through such a behavioral model solely? I think that we need to broaden the way that we treat ADHD in a way that it encompasses so much more than that, because that's just turning people with ADHD into robots. That's only going to work this portion of a time in the grand scheme of life. We need to work on rebuilding self esteem. So, this message is to both clinicians and clients or people. Clinicians, broaden your perspective. I really encourage you, like I said, if you have somebody come in who either has a diagnosis of ADHD or you're suspicious of it and you're working through a diagnosis of ADHD, throw out some executive functioning tools. Of course, I kind of view that the same as coping skills. Let's get a few things out there to try, trial and error, see what works. But before you spend your full hour of session trying to fix the problem of ADHD, before you focus solely on behaviors, talk to your client about their view of themselves through the lens of ADHD. What do they believe about themselves through what they have learned from their symptoms? Start with that. And if you are a client, we'll start first client and then just general human being, maybe not in therapy. If you are a client and you know you have ADHD or you're suspicious of it and your therapist is not having this conversation with you, initiate it. I way back when, one of my first episodes, I think, it was about like what is good therapy and how do we recognize it? Initiate the conversation. Sometimes your therapist is just trying to conceptualize so much at once. And it's not that we don't want to talk about it through this lens. It might just be that we're focusing on something else. Initiate the conversation. Say, hey, I know I have ADHD. I know that executive functioning and behaviors and maybe potential medication management is an important part of my treatment. But can we talk about how I feel about myself? Can we talk about my identity in relation to ADHD? Bring it up. The worst case scenario, I promise you, the worst case scenario that happens out of this is your therapist shows you that they're not a good fit therapist for you. Your therapist maybe doesn't respond in a way that's helpful, or maybe is very behavioral, very CBT, or even just behavioral therapy or medical model. And that's okay. That works for a lot of people. Maybe that doesn't work for you. So the worst case scenario is you learn more about whether or not this therapist is a good fit. Majority of the time, your therapist is going to be like, hell yeah, of course. Let's talk about that. Let's figure that out. And then you can dig deeper into that and use that as your foundation. So, clients, please don't hesitate to advocate for this part of your treatment. And the other flip side of that is it can be very vulnerable, right? So, I'm sitting here like, yeah, advocate, initiate the conversation. But we also have to look at the other side of that. Of that might be extremely vulnerable and very hard to address. So, with that being said, if you're not in a place where you feel like you can initiate that conversation with your therapist, start to think about it on your own. Start to journal about it. Maybe drop little pieces in your session. If you can be sneaky in your sessions, you can say like, "Oh yeah, I didn't get XYZ thing done and it really kind of made me feel like shit." Okay, that's kind of an easy way to segue into something more vulnerable. Drop some breadcrumbs for your therapist to pick up on, and then maybe kind of guide the conversation in a less direct way if it feels too intimidating to jump in and say, hey, I want to talk about this. Human beings, if you are not in therapy, if you are not a client, number one, I'm going to recommend finding a therapist, getting out there, seeing if it's something that might be more helpful for you. I think, especially for those of us who struggle with ADHD and are not in therapy, if we don't have that space for someone to kind of poke around and help us understand ourselves through that lens, our natural instinct is to go to the behavioral tools, executive functioning list of things. And again, great, we need those, but we might just be missing this part of identity. So, my first suggestion is to start therapy. I think it's a great approach. I think it's a great way to get to know yourself a little bit better so that the tools you're trying to implement will actually do what they need to do in the long term. So, that's number one. Number two, journal. If you don't feel good about how a day went, if you don't feel good about your level of productivity in that day, write down how you're feeling and please use pen and paper. I think we're so attached to our phones and we're so attached to using our notes app. And maybe 2 or 3 years ago, I might say to people, yeah, use pen and paper or your phone, whatever you're most comfortable with. I'm totally shifting back to pen and paper. I think that part of this, especially with ADHD, that dopamine hit, opening our phone and like typing in our notes app gives us that dopamine hit in a way that kind of leads into that instant gratification. Slow it down, grab a pen and paper, handwrite it, slow your brain down, and really allow yourself to look at how you're feeling about yourself and ask yourself these questions like, okay, so I didn't get to the grocery store today. What am I telling myself about myself as a result of that? Like, what's my belief about myself because I didn't follow through with the thing I needed to follow through with? And then look at it through curiosity. So, your journaling is not meant to be a letter to yourself shitting on yourself. It's meant to be a letter of compassion to yourself or processing how you're feeling, just writing out the facts. So, I feel like a lazy piece of shit for not making my bed and going to the grocery store and showering and doing whatever functioning things I need to do that day. Curiosity. Why didn't you? What were you feeling? What was hard about it? What was on your mind instead? What were you distracted by? Just lead with curiosity. And I promise you that will bring out so much more insight than just shitting on yourself because the cycle of shitting on yourself might lead to a day or a week or, even a few weeks of motivation because you're like, fuck this. I want to do better. I want to feel better. But that's only going to last until that dopamine hit drops. It's only going to last until you're bored of that and it's not sustainable and you're exhausted of it until you get right back into this cycle of suck. So please try to look at it through a lens of curiosity and through a lens of identity and allow yourself to get to know yourself a little bit better outside of the lens of just the behavioral, just the neurological side of it. So that's my episode for today. Short and sweet. I know that ADHD is such a big topic, and I'm more than happy to do more episodes on it. I would love to hear from you guys if you have specific questions or experiences or things related to this topic that I can kind of hone in on. That'd be super great to hear from you guys. And I'm more than happy to tailor any episode that I can to you to what would be most helpful for you. If you're looking for more information on this, I suggest going back to my episode about dopamine. I know I talked about that just in general. It wasn't solely focused on ADHD, but it's kind of one of those things where that episode definitely applies to what we're talking about here. Because the ADHD brain is so low on dopamine, it's really seeking anything it can get from dopamine. So definitely go back to listen to that episode and maybe from there gather some questions or thoughts that you have. And yeah, I hope this was helpful. Please, of course, let me know how this resonated. Leave a rating, a review, a comment on Spotify, and I will be back next week with another new episode. See you then.